Normal healing in other specific tissues. Bone healing follows similar phases to skin healing but with some distinctions. Most fractures heal through callus formation, a process that includes intramembranous and endochondral ossification. This is referred to as indirect or secondary bone healing and is typically seen in non-operative fracture treatment. Initially, a hematoma develops at the fracture site, triggering an inflammatory response. The fracture hematoma gradually transforms into a soft callus. Subsequently, this fibrocartilage callus undergoes endochondral ossification to create a hard callus, which consists of woven bone that aids in stabilizing the fracture. Intramembranous ossification also takes place directly near the distal and proximal fracture ends. The formation of a hard callus is succeeded by bony remodeling, during which woven bone is replaced by lamellar bone. On the other hand, primary bone healing is a direct union process that involves intramembranous ossification without callus formation. This type of healing is not common in the natural healing process as it necessitates the direct alignment and rigid fixation of fracture ends with complete stability. In cases where a gap exists, secondary healing may result in delayed union, non-union, or malunion. Therefore, primary healing is the objective of open reduction and internal fixation surgery. Nerve regeneration and degeneration are complex processes that occur following nerve injury. Wallerian degeneration takes place distally, while proximally it extends to the nearest Ranvier node. Regenerating nerve fibers are guided by neurotropism, influenced by various factors such as growth factors, hormones, and the extracellular matrix. Damage to the perineurium and inflammation can lead to the formation of neuromas, which are characterized by disorganized nerve regrowth and can cause pain. In the case of tendon injuries, repair follows the typical wound healing process. Two main mechanisms help deliver nutrients, cells, and blood vessels to the severed tendon. Intrinsic healing involves the vincular blood supply and synovial diffusion, while extrinsic healing relies on the formation of fibrous adhesions between the tendon and its sheath. Early mobilization after tendon repair is crucial to prevent adhesions, maintain range of motion, and promote intrinsic healing. Additionally, splinting is necessary to protect the tendon repairs from rupture.